conversations that I've always hoped that we could have. And it's really indicative of, these are just some of our goals and our action plan. But we recently were awarded from the Foundation for Healthy Kentucky, one of the big Investing in Kentucky's Future grants, because of our coalition work. And so this is our health park that we have just almost finished building, actually, in Paducah. We have a playground that the Rotary organization put together. We have a walking path and fitness equipment, a community garden there. And it was really because of that trust building that we were doing with that coalition. But also what I'm excited about is, even though we don't have the expertise necessarily in our community to be tracking these things from the evaluation perspective, all these grant entities, as you guys know, bring on those expertise. So we're really utilizing the evaluation methods from the foundation to make sure that we're asking ourselves if it's working, how can we iterate to make it better, and all of those things. So even though we don't have the expertise, I guess that was one of my big lessons learned. You can always find it. And for a long time, I guess I felt like we were gonna have to get over this big hurdle in order to be able to respond in the way that I wanted to respond, but patience always wins, and I don't have much of it. So the next thing that we've done, and this is a really great thing, speaking of breaking down those barriers for data sharing, so our two main hospitals, actually we have a third smaller hospital that's joining on board, and also Murray-Callaway County Hospital. All four of these hospitals are going in a partnership with our coalition to put together a transitions of care and community health worker program. This is brand new. We were just awarded in June. But every single one of those entities said, yes, we're going to data share. And I know that doesn't mean they're going to share the most important proprietary stuff. We understand that, but it's a good step in the right direction, and we're really proud to be there at a time when 10 years ago someone would have told me this would have never been able to happen. So that coalition building really did work for us. So fast forward to me winning this race. And so I didn't really know I was going to run for office until like 4 days before I decided to run for office. And now I am excited to be the mayor, and I'm really excited to have this health focus for our city. Because at a time when we have few other competitive advantages when it comes to economic development, I do think that we have this great opportunity to win the health race, if you would say. So this is my big vision for Paducah. We are now in the discussions of doing a Blue Zones project. I'm sure many of you have heard of Blue Zones. We have actually had them to our community to do a 3-day community event to see if we're ready for it. They indeed are excited that we are. I was talking to someone earlier about how expensive the Blue Zones project is, and so it's one of those things that we're all really wrestling with. But the thing that the Blue Zones brings to the table that I get really excited about is the accountability and the well-being index that they partner with the Gallup poll on. To me, that is the step that my community needs to be able to understand what it means to be data-driven, to be able to hold ourselves accountable for the money that we spend on health. If you guys all know, we are a UNESCO Creative City. We spend a lot of money on arts. We have a $40 million performing arts center. We spend a lot of money in the arts. And so from my perspective, it's time that we shift and start spending it towards health. So my goal is to create the healthiest city in Kentucky over the next 3 years. And thank you guys all so much for having me here. I really appreciate it.
Okay, here we go with high energy, I hope. I've got two people that are helping me, Marcia Bach and Elizabeth Steffer from the Health Department, Northern Kentucky Health Department. They've been a great partner with the City of Williamstown, so I wanted to introduce them, and also I was told that there could be a wet zone, so beware of whatever that might be. So I'm Rick Skinner. I'm the mayor of the City of Williamstown. I've been mayor for 7 years. Before that, I was on city council for 7 years, and I have one year left, and I am definitely done. I've had a great time. To let you know, Williamstown is just south of here, about 40 miles, halfway between Lexington and Cincinnati on 75. We are home of the Ark Encounter, which is full-size replica of Noah's Ark, if anyone's seen that. But we have moved from being a bedroom community to Northern Kentucky and to the Georgetown, Lexington area to becoming much more of a tourist attraction. So we're changing there. But one of the things that that I was very interested in when I took office was to become more of a mayor that stood for health. And I think that's why I'm here today. And hopefully from what today you gain is that I give you the idea of how I use the data that you produce, and we collaborate with different partners within the community to result in results. my wife and I, my wife is retired as a superintendent of the Williamstown schools, and she constantly was talking about obesity in the preschool and Head Starts and how they couldn't even use some of the equipment because they were obese. And so I knew that coming in that was going to be an issue. So I pretty much decided that we needed to collaborate with whoever we could. And that list keeps growing because as we add new projects, we get new partners in with the city of Williamstown. And Williamstown quickly became known for their health issues and some of the successes we were having. So it was pretty easy to attract new people into work with the city of Williamstown. And then the data, most of what is produced around here, we relied on it. As long as we could prove the results were accurate, then we used that data. And we used that data to guide what we wanted to accomplish and to direct us in the ways that we wanted to go. And we did. We got results. We used the county rankings, and when I started office in 2011, we ranked, for the whole state, we were 84th out of 120. In 2017, we ranked 54. So we improved by 30 counties. So I thought that was really great. And then the other thing, quality of life, which I'm always been about and still work very hard on that, we ranked 96th in 2011, and in 2017, that was down to 25th. So, you know, we've moved the bar, and we're excited about that. And we know there's a lot of other good things to do. One of the first things we did was a comprehensive plan. We had Kentucky League of Cities come in. That was right after the ARC announced. We wanted to have a roadmap of how we were going to go and develop areas, how we were going to treat health, how we were going to treat the growth in the area. And so the master plan was our first thing. And with that, we picked up, our park system had been neglected for many, many years. So we added one thing with J.B. Miller Park was a 1 mile loop around what was called the old reservoir. So we improved that. It had a path down to it, but we improved that all the way around and keep that mulched yearly. And the other one was we became a Playful City. And with Playful City, we applied for a grant for new playgrounds. So we got 2 new playgrounds in our largest of our parks. Playful City was a big part of that. Like I say, we became partners with doing that. And see, that's why it's hard to concentrate with my props coming through, but you know. I just want to see this happen. So Playful City was great. They gave us a lot of things to do. One of the things we did was they asked us to road map all the playgrounds that we had in Greene County, and we got joint use of playgrounds at all the elementary schools, and then that's mapped on one of their applications. So one thing we've seen from that is people planning vacations, since we're right on I-75. You'll see them come down and they'll be at one of our parks. We kept wondering why there were so many out-of-state people, and so we started to ask some of our park managers about that, and it was because they had planned to take their kids, you know, for a break as they were coming down 75 or going back 75. Complete streets policies. Yeah, one more lap. So Williamstown was the first to do complete streets. Those are some of our new sidewalks. That looks like computer generated, we said when we saw that, but that's actual sidewalks on a new bypass that was put in, and we were able to put those sidewalks in through a grant. But one of the things that drove that for the city of Williamstown to be so receptive to that in the city council was that 98.6% of the data said that people were in favor of complete streets. So from that complete streets, we were able to keep going, and we had complete streets all the way through Williamstown, Dry Ridge, and Crittenden all went into that, and so did the county. So any subdivision that we have now, we require that they have sidewalks in them, and then we connect all the sidewalks to the subdivisions. So A couple other resolutions that we had was our healthy initiative, and that was where if we were going to be a leader in health, we had to make things accessible. And we wanted to make, we still want a marketplace for fruits and vegetables, and we're working on that. But we also came up with what was called an edible city program. And basically, an edible city is defined as a place full of plants and produce of abundance with fresh, delicious, and healthy food every year. And what we are doing is we're planting those along our sidewalks, in our parks, and those areas, and the fruit is free to anybody that wants to take it. And as the trees grow bigger, we have an electric department that will house that fruit, and we'll take it to the schools, and the schools will distribute it to low-income families in that way. Tobacco-free parks, that's one of the things we've just recently done. Our school under my wife became a smoke-free campus 4 years ago, and that you just don't know how distracting it is, you know. But I guess hopefully this will be high level. Can we count this as high energy? Okay. So, but the health department came to us and explained the benefits to city council. They explained the benefits of smoke-free park. We understood those. We had such a good relationship with the health department that we knew that that was something we wanted to do. And we got asked questions like on this health-free or smoke-free that, well, are you going to have areas in your parks where they can smoke? And the answer was no. You know, it's a smoke-free park. That's what it's going to be. We don't want to have somebody over in a corner smoking. And it's a bad concept. If you see, you got kids playing, to me, if you got kids playing and you see people over there smoking, well, that sends a wrong message to those kids that could be okay. So I'm really proud of the City Council moving in that direction to make tobacco-free parks. One of the best things that happened to us was a flag, Fitness for Life around Grant County, who I'd been working with a lot, received a grant from Interact for Health, a 3-year grant for $300,000. And that made one of the biggest differences, and that made Flag and City of Williamstown stick out as one of the leaders in the county in doing things for better health. Some of the initiatives we did were school gardens, health food selections at the schools. We were able to change vending machines there to healthy products, sidewalks, splash parks. Oh yeah, I forgot splash parks, okay, yeah. Play spaces, walking routes, active workstations with schools. That one top picture was, we did the dedication at one of the local elementary schools of our playground, and it had rained just before that. Of course, I want to be the first one down, and you know, I didn't realize until I was right there that there was water right at the bottom of the slide. So. But we did playgrounds in 2 of the elementaries, one of our smaller cities, Corinth. We did extensive work there. We updated the Piddle Park in Dry Ridge. So it was just a great time working with the foundation, and I learned so much more about health policies from the foundation going to the convening. So it was just a great experience for me to go to some of that. Another one that was easy for the city of Williamstown to do was the syringe access exchange program. Dr. Saylor from the health department came and spoke to the city council, and I was really extremely proud of the health department for what they presented, but I was also extremely proud of the city council because they had done their homework. They had so many intelligent questions, and they made intelligent decisions. And I know syringe access is controversial. It's worked flawlessly in Williamstown and Grant County, and I'd recommend it to any city. One of the things that we've just finishing on, and this is with Interact for Health, they gave us a $33,000 grant to do a feasibility study on our trailhead system, and that would be a system from Corinth to Crittenden going all the way up through interstate and connecting all our cities. Not only connects our cities, but it'll connect our parks, it'll connect to schools, and it will also connect to the ARC encounter. So it's not only sidewalks, it'll be bicycles, it will be in the south end for horseback. Some of that will be in horseback trails for now, but That's really gone well for us, and we're excited about that. We just invest in physical activities. That's one thing we wanted to do. We wanted to get the kids out doing things. One of the things that we started 7 years ago was Paddle Williamstown. That went tremendously well. We have a 300-acre lake. And in that 300-acre lake, I didn't know if she was going to do something or not. Oh, you're paddling, okay. I wish I was turned a little more this way. And we closed the lake off to power boats and any kind of jet skis or anything like that for a Saturday. And all you can do is kayak and canoe. And what the city does there, we rent the kayaks and canoes if they don't have it, and we re-rent to those people at a discounted price. So we average 250 to 300 people a day for that. So that's been very well received. For the last 14 years, we've done the 5K Derby Dash. That's the culmination of what Flag Fitness for Life around Grant County has for their biggest winter contest, which is usually in the month of April. But it's a 5K that runs through the middle of town, and it's been very, very successful. It gets all ages out and moving, and it's walk, run, so if you can't run, you know, a lot of us walk, but it's a great way to get out and do something. The Mud Run obstacle course, this is in its 4th year. We do it the Columbus Day weekend. It's a 3-day weekend, so we thought that was good. It was a little late in the year, but there's a lot of competition for mud runs. But the city, with their electrical department, built all the obstacles, so that worked out real well. Now it's one of the major fundraisers for 4-H and Flag, so we're real proud of and it is a 5K run also. Service Day, we just recently started that with the Williamstown School District. We have projects within our park systems and at each of our departments, and so we have kids come in to help us. This is where they're spreading mulch at one of our playgrounds, and then on the trail at J.B. Miller Park. It's a big success. Also with the kids, we do a walk to school program once a year also that works real well for us. There's my information. I believe in health. I believe that it increases the quality of life, and that's what we're all about. And I'm just hopeful that you can see that it takes the data that we collect in collaborations with others to make it successful. And I'm really proud of what Williamstown does. And it's with this great collaborations and data-informed initiatives, we can and you can make a difference in your communities that we call home. So thank you.
All right. Good afternoon. My name is Lee Tammy. I am the Chief Performance Officer for the City of Cincinnati. I'm just going to really briefly go through my PowerPoint and then actually kind of show you what we're doing with data. So this is a little bit of a misnomer. Really, public health and open data, I should really have called this why open data should care about public health and why public health should care about open data. So just some background. Our office has existed in the city since 2015. Basically, we exist to steward data. We collect data, we centralize data, we clean data, and then we push it out. This makes us pretty unique among government entities. A lot of governments are not sort of consolidating all the data that they have. We've worked really hard to do that. So we use data to generate insight, to make data-driven decisions, to improve processes, and do a lot of creative problem solving. So these are some of our initiatives. I'm going to really focus on the last two, which are how we push all that data together and how we use our open data portal in Cincy Insights. So how are we using data? So from the city government perspective, do we have good data is the first question that we ask, and I think this is true in any arena. By way of background, I am not a data person or a health person. I am in fact a lawyer by trade, which I don't normally admit in any context. But so I didn't really come from a data background. I came from a problem-solving background and really am driven by curiosity or nosiness, right? So when I think about data, there's a few things I want to know. what is this issue that we're trying to solve? Is this data set complete? Do I have all this information? Who's inputting it? What does it mean? Do I really kind of know what I'm looking at? So this is pretty unique to the city of Cincinnati. We've developed a data infrastructure. So this supports all the data that comes in and the way that we push it out. So the first part is data processing. This is essentially, in other words, how we make sure that Vine Street is spelled the same way in every single data set that we have. So that's sort of the example I use, but it's true. A lot of our problems with data integration are that we're not sort of collecting data, we're not inputting it in the same way, we're not processing it the same way. So in one data set, Vine Street might be Vine STR. In another data set, Vine Street might be Vine STREET. And no one will know that sort of we're tracking the activity that's happening in the same location unless someone is doing this. So we currently pull data to our central warehouse from more than 200 sources around the city. We have a central data warehouse where we keep clean, complete, real-time data. So this is pretty unique. We pull it in, we house it, we keep it, and this is how we integrate our data sets within the city. So I guess my additional point to this is if you're in government or you're working with government, this is a doable thing. This is something that we sort of come to expect in a lot of other industries, and I think that government is moving in a direction where data integration is possible, and we can then use it for analysis and problem solving. So then the third component of this is really the first part when we extract it, when we transform it and load it, is how we turn data into information, right? So then we store all this information, but it's not really helpful unless we're looking at it. So I'd say that this is how we turn information into insight. We start visualizing it, we start analyzing it, and most importantly, we make it available for public consumption. So these are some of the types of data that we process. We actually work closely with our health department, so we get for internal use, we have health clinic data, we look at police data, blight, emergency medical services, we do survey data, we have financial data. So really a lot of this is about how do we pull all this information in and like try to see what's happening during the same time, in the same places, for maybe some of the same reasons. So the first step in making this data usable from a city perspective is having an open data portal, and I think this is a huge asset that governments can really capitalize on. Our open data portal has more than 55 data sets. We're always adding more, and our emphasis is data quality. So when we put data onto our open data portal, it's geocoded, it's complete. We try to make we have uniform data characteristics. Essentially, we're trying to make sure that what we're putting out there is consumable so that anyone can kind of look at it and make sense of it. So this is our open data portal. The next step, aside from having an open data portal, is having some kind of data mapping or analysis or visualization. So like I mentioned, I don't come from a data background. I don't come from a health background. I come from sort of an analytical background. And when I looked at our open data portal, I thought, well, this is great. I feel good knowing this is here, but like, what am I actually going to do with this? I don't really want to like map this myself, and I would have to update it every day if I was sort of doing it ad hoc. What are people supposed to do with this information? So this was the basis for Cincy Insights, which is our interactive open data portal. It makes city data usable and completely interactive. So I'm actually going to switch over here. This is a little theatrical here. All right, let's see. Oh, nice. All right, so this is our website. It's all public facing. It's called Cincy Insights. So it's insights.cincinnati-oh.gov. And looks like it's having some issues loading here. It's not responding due to. So should I stop the? Just reload it? All right. It's cool when you see it, I promise. It's also mobile friendly, so you can pull it up on your cell phones, and all of our visualizations respond immediately to a mobile phone. No? Okay. I mean, so when you, try it in Explorer. All right. All right, so we'll do something a little different. Does everyone have a mobile phone in here? Do you? All right, we'll do it this way. So if you go on your phone and you go to just into Google, put Cincy Insights. Oh, now it's working. All right, you can still do it that way. So maybe it's working. Do I need to? Okay. All right, so if you're on your mobile phone, you can go to quick links at the top, or you can search by topic and go to Safer Streets. Has anyone found that? All right, so click on, probably by priority is the easiest way to do it. So click on Safer Streets. Is that working for anyone? If you go to Safer Streets, you'll hit an icon that says Heroine. So this is one of our, unfortunately, most notorious visualizations, but it's actually been pretty informative for members of the community in understanding how this epidemic is affecting them and what's going on where they live. So if you scroll down here, oh my gosh. All right, so this is our heroin overdose response tracker. So this is just computer-aided dispatch data. This is all from our EMS data, and we're mapping the number of overdoses by neighborhood, by month, by day, by medic outcome, by hour of the day and day of the week. So let's say that I want to see a particular neighborhood. I want to see downtown Cincinnati. It's not loading here, but you can do this on your own mobile phone, your own mobile device, actually. There should be something that says click here. If you click on a neighborhood, in theory, everything else will filter against it once it's loaded. So if I click on downtown, or if you click on downtown in your own mobile phone or on your laptops, everything else will filter against it. So you'll be able to see everything happening downtown by hour of the day, day of the week, percentage of medic overdose outcome, percentage of medic transport, et cetera. So it's not really loading in here. Is it working on anyone's mobile phone or anyone's laptops? Awesome, so you get it then. So that is, we have that for not just you can see it by month, you can see it hour of the day, day of the week, by outcome. If you hover over any of these in a version that's working, you can see, you can search by street. So the search by street has been a really powerful tool for people to be able to use. They can see where things are happening, where they live, if it's happened recently, if it's good or bad, based on sort of what the frequency, et cetera. So I think the other thing I would say, there's sort of two sort of components of this, right? The first is we don't just do this for things like heroin overdoses. We have this for potholes. We have this for private lot abatement, blight. We track our street sweepers. We track trash collection. So we have a lot of data that we're putting out there in terms of that affect things like quality of life, that tell people, about litter in their communities, what the city's doing to clean it up. The city government collects a ton of data. I think the second component of this is it's when people see things mapped like this, when they can get on their phone, when they can sort of look at it, it gives them a real sense of what's happening where they live and why that's something that feels relevant. And I think that's really what's been the most compelling part of this for us. Again, as someone with no data background and really no health background, but with a background in wanting to solve problems and being really nosy, something like this is really helpful because it allows me really quickly and easily to search by my street, look at last month, look at my neighborhood, look at an hour of the day, and I can sort of see what's going on. So why is this relevant to public health, right? So this particular tracker is something that I know not only members of our internal departments use, but members of the community use as well. It's really helpful for them to see these are neighborhoods where we've dispatched the fire department or the police department to answer overdose responses. This is where we have police calls for service. This is where we are seeing shootings. It's helpful for them to see, to sort of contextualize, this is what's happening in these areas, and this is either how we deploy resources or how we can sort of inform our communities and get a better sense of what's going on. So that's pretty much it, I think. I'm still a little thrown by, I apologize, this isn't, now it appears to be working. Oh, not on mine, on that one. All right, so is it working back there? So click on a neighborhood. Or a point, that's fine. So yeah, everything else filters against it. It's cool, you should check it out. You should expect this level of data transparency from your governments. That's really it, so thanks.
I'd like to say thank you to all the speakers, and we have approximately 14 minutes for questions. If anybody has any questions, go ahead, please.
Yeah, I had a question for Lee. Did you guys have a lot of pushback when, I know that all of the data that you have up there is de-identified and a little bit de-identified in terms of location as well, not just person. Right. Was there pushback within the government, I assume there was.
Yes.
And can you talk a little bit about that?
Yeah, we had a lot of pushback. I think what I would say to any government agencies or government entities looking to do this, there's sort of there's really three ways that you can get access to the data. The first is you sort of insist on it, which I think is important, right? Because I said this recently in another context, no one has ever been hurt by data sharing. No one has ever sort of put out because they shared their data. I mean, obviously there are issues like de-identification and that sort of thing, but no one is worse off because they collaborated using their data with others, right? The second component of this is a lot of government agencies don't even know what they have. So when we're able to say, this is really why we have so much police data, this is the trick to our police data on our open data portal, our police department really had no idea what they even had until we were able to say, look, we'll pull this in, we'll geocode it, we'll assign neighborhood, we'll make sure all your timestamps are right, we'll make sure everything is mappable, and you can really start understanding what you even have been collecting for all these years. I'd say the third way that we sort of dealt with or overcame a lot of the pushback that we got was saying to departments, haven't you always sort of wanted to know what these other departments are doing? So, that's like, it's pretty compelling. It's sort of, for lack of a better way of putting this, if you say, look, you kind of have to not pay to play, but you have to participate to play. So if you want to put if you want to sort of participate in this and benefit from this, you put your data in. Now you can see what code enforcement is doing. Now you can see what public services is doing. Now you can see, buildings and inspections, or you can see some of this health data. So I think that those are sort of the ways that we've really tried to target any pushback that we've gotten internally.
What about opening it up to the wider, not just government, but also people journalists?
Like making it open? Yeah, so I think this is probably the only time in my whole professional life when being a lawyer is advantageous, because I can say, people will say, well, this is not, so that's part of it. We also actually in the city of Cincinnati have an admin reg that outlines the entire process for pushing something to open data. We drafted it with Harvard Cyber Law Clinic. It's out there if anyone wants to look at it. It outlines sort of the way that we do this. So we make sure that we have subject matter experts, law reviews all this data. We make sure it goes back and forth a number of times to make sure that when it gets put out, it's clean, it's accurate, and everyone agrees that that's what it should be. I think actually the open component of it has been less difficult maybe than previously it has been, primarily because a lot of our departments are starting to get so many FOIA requests. So when we say to them, look, you don't have to keep answering all these data requests, we're gonna put it out there for you, and you just tell these journalists or whoever, this is just go find it, it's out there already. It's really taken a huge burden off their plates.
Any other questions? I have one question for all of our panelists, and this just relates to sort of community outreach and the way of getting community collaboration. Would each of you all comment on outreach to community and finding out what data they want, and just your experiences with that?
Sure. So from my experience, like I said before, the learning curve seemed pretty steep in my community for someone being able to answer that question in the first place. So we struggled a lot to know what that meant, what was available, what kind of data are they collecting. I think that's kind of the aha moment when people start looking at this, right? You kind of all of a sudden uncover these insights. For us, it was more of going through kind of the traditional community needs assessment processes and those kinds of things to kind of bring in insights. And that seemed to kind of open up quite a bit of that understanding of what we were looking for and what we're needing. But now that we're getting these more programmatic things in place, like the HRSA grant that we talked about earlier, you can start to see those things starting to uncover themselves a little bit more, and people are starting to talk about them. But in the government side, we have a long way to go, especially after hearing you speak. And so I'm excited to learn from what you have been doing, because we have a long way to go on that for sure. Yep.
So I think in community engagement, the primary thing I would say is we have to do it. This is a little bit sort of in my background, but I think that I think something at least that I've noticed among my peers in other cities, and really anyone doing anything, sometimes are really afraid of constructive feedback. Constructive criticism, rather. So for us, I think it's really important that not just that we make this public, but that we are constantly getting feedback from people in the community. This works, this doesn't work. I know what this means, I don't know what this means. This is usable, this is not usable. When we first put this out, one of the first things we kept hearing is, well, this is great, but I don't have a computer, I don't have a laptop. That's why we immediately made sure that we were making all of our dashboards mobile friendly, because as much as I sit at my computer all day and kind of look through this stuff, most people don't but most people do have a smartphone with an internet connection. So I'd say not being afraid of constructive criticism is sort of key to any work like this, particularly in government, particularly if you're doing something that you're trying to make maximally usable. So I don't know if that answers your question.
At different times, we had community listening sessions, and those sessions not only collected the data, but gave us a lot of feedback. And we did our roadmaps from the feedback that we got from those listening sessions. And then there was a couple surveys that the Northern Kentucky Health Department gave where we analyzed the data and put that data out, where we got comments back on some of the things that we found out. So.
Any other questions, or go ahead?
For city council meetings are pretty boring overall. And no one attends them, at least pretty much in Williamstown, unless there's a topic that's controversial. So if you come to those city council meetings, not only does the mayor focus on you and what you're wanting, and if you don't talk about it during the comment section, I can guarantee that somebody on city council or the mayor will come by and talk to you later and say, I appreciate you being here because no one comes. What can we do for you? Why are you here? And especially if it's a citizen that wants to help and do to improve, then we're going to be a lot more receptive to you. And like I say all the time, I mean, if you give us ideas and it's something that we can do, we want to work with you as a partner to do it. And I think that's how we got so many collaborations, was because of something like that. So I'd say come to the city council meetings would be the first place.
My meetings aren't boring yet, but I just got started. So I have two thoughts. One is going to each council person individually seems to work really well, and asking them questions about their goals for the city and tying your thoughts back to their goals. I think that works tremendously, because most of the council people have their own visions, I would say, for the city. And then secondly, tie it to economic development. I mean, the more times you can do that, actually this Blue Zones conversation we're having, because my public health brain is on all the time, I wait till the very end to even talk about economic development when I'm talking about this, and then that's when I get all the ahas. So I've got to flip that around on myself. So I think tying it to that also works. Yep. Mm-hmm.
Any other questions? All righty, thank you then.
So what a delight to get to spend a day with all of you folks thinking about health data. We really appreciate you all coming. Interact for Health is always thrilled to sponsor this conference along with Foundation for a Healthy Kentucky, and especially Rochelle Seeger, my partner in crime, who put in all the blood and sweat and tears to get this pulled off today. We also thank Health Landscape for being a supporting sponsor. Tomorrow, you'll receive a link to a post-event survey, so we really appreciate you giving us feedback, what you liked, what you'd like to see more of. We really do use it when we plan these. That's it. Again, another thank you to all of you and to our presenters today, and have safe travels.